Dr. Vahora, we're going to talk a little bit about something that I think confuses women all the time. They feel that if they have pain with their cycle, that's normal. They're supposed to have cramps, they're supposed to have pain. I'm talking about pain like somebody else would say it's appendicitis pain. Can you comment on that?
Yeah, thank you very much for having me on today. Women can have some pain with their periods, but the pain that they have with their periods that changes their life, that they cannot go to work, they cannot go to a wedding, they cannot go to brunch with friends. Any pain that is debilitating, it is not normal. So it commonly can occur. One of the conditions we worry about, you and I mentioned earlier, was about endometriosis. So, endometriosis can affect 1 out of 10 women. So, if you think about 10 women that you know,
Mhm.
one of them is suffering silently with endometriosis. Endometriosis is when the tissue and the endometrium, instead of coming out of the vagina with your period, implants into other areas, into your ovaries and on your uterus and in your pelvic area.
So, just to interrupt for our audience, it's kind of like the uterus has reflux, and instead of going out and not the acid, the blood and tissue comes up and then it implants wherever it lands. So, anywhere in the abdomen?
Anywhere in the abdomen.
What about the chest?
So we do see rare cases of endometriosis in the diaphragm or lung or a colon and things like that. So what are your symptoms that you're looking out for is your pain with periods, pain with sex, pain other than the periods. Some women have pain with bowel movements too, and that can be a sign of endometriosis as well. So important to realize and talk to your physician about the symptoms that you're having and not just, oh, my mom had pain with her periods, my sister had pain with periods, and I have to live with it. So there is many treatments out there, medical treatments as well as surgery treatments. But many women would go to 5 or 6 doctors before being diagnosed, and we have great treatment. And again, we personalize the treatment for the patient.
What do you think the challenges with endometriosis as far as getting to that? Like, why isn't that on the differential for any doctor?
Well, I think it's about awareness. And a lot of times women's diseases have been minimized, and people think that, oh, that's just normal because I call it menstrual bullying. Like, oh, you have heavy periods, painful periods. Your sister did, my mom did, your aunt did, and it's just normalized. But it's not normal, and we have great treatment for it. So if you're having these symptoms, it's about impacting your quality of life, and we don't want women to suffer silently. So you should see your physician and talk to you about being treated. For many years, we thought that you had to have surgery to diagnose it, but now you can clinically diagnose it and then offer treatment to the patient. So not everyone needs surgery to diagnose.
Perfect. Very good. Very timely because I have a patient I just referred to you, and I'm really hoping that you can get to the bottom of this for
Right.
us.
And I look forward to seeing her. Thank you for trusting me and taking care of your patient.
Thank you.